Well, Greg and Stephanie, Dr. Michelle Taylor says that she wants to continue to make data-driven decisions. So in moving forward, that rolling 7-day average is going to be the best indicator we have about potential next steps. And right now, that average stands at more than 800. Now, Dr. Taylor told commissioners this afternoon that we are in the stage of this most recent surge where we are losing too many people we don't have to. Commissioner Mark Billingsley expressed concern that it seems to be business as usual as more people die, cases surge, and our hospitals are pushed to their brink. Dr. Taylor says we are starting to see a plateau, but with the start of football season and festivals, these next 2 weeks will be a very good indicator of the direction we're headed. They stress we must increase vaccination rates and mask up in crowded outdoor spaces where social distancing just isn't practical. We could see more restrictions if people choose not to do that.
Very difficult to enforce, and so that's why we're taking a different type of approach this time, because we understand that we need to rely on people to make good decisions. But there are other things that can be done that people remember from the beginning of the pandemic. There are capacity limits that can be put in place. There can be outdoor masking in crowded spaces that could be put in place. Now, naturally, we don't want to have to do any of those things. What we want is for people to do those things willingly. And we also know that private businesses can put in their own restrictions. They're not required to have the health department do that.
Now, Dr. Taylor says this current health directive expires at the end of the month. At that time, they will look at the numbers to determine if we're going to move in a direction of easing restrictions or tightening restrictions here in Shelby County. Reporting live downtown, Janine Lewis, WREG News Channel 3.